Hello, graduates. My name is Tahira Kareem. I am an NCLEX Success Specialist with our VM Licensure Department team. Welcome to our NCLEX Review Series. This presentation will focus on the category of safety and infection control. Let's get started. Safety and infection control is a subcategory of the larger client need area of safe and effective care environment. Safe and effective care environment can account for approximately 1/3 of the entire NCLEX PN exam, making this a significant client need area. Of that, the safety and infection control subcategory can account for around about 10 to 16% of the exam. The questions within this topic center around how the LPN contributes to the protection of clients and healthcare personnel from health and environmental hazards. In this presentation, we will review the objectives of this client need area, examine topics that questions may be addressed on, and as well take a deep dive into a case study along with key testing strategies that can be of benefit to you. The NCSBN details the objectives of each client need area on the exam. The above objectives are provided from the NCLEX PN test plan. You can find more details on these topics by downloading a personal copy of the test plan from nclex.com or contacting your campus NSS. With the first objective area of accident, error, and injury prevention, the test will assess the novice nurse's ability to properly implement safety protocols and work to prevent errors or injury to patients. You will find question topics ranging from identifying client allergies, proper methods of patient identification, identifying factors that place clients at risk of injury, especially falls, and knowledge and proper use of car seats as well as other safety devices. In addition to the topics previously listed, this area can also include questions that address topics including safety of the healthcare environment, reinforcing teaching points for patients around safety, proper use of transfer and mobility devices, fire prevention, and proper implementation of safety protocols by health providers. The next objective in safety and infection control is the emergency response plan. This portion of the exam will assess the novice nurse's understanding of what proper planning is for emergency disasters, how to respond during the actual phase of a disaster, and then how we also care for our patients following the disaster. Demonstrating understanding of the nursing role within this can also be tested. Some scenarios can be centered around fire safety, tornadoes, or even tragic incidents, just to name a few. The objective of ergonomic principles centers on the importance of body mechanics for healthcare professionals and patients. Proper positioning for the nurse can help prevent injury to the nurse and the patient during a patient transfer, for example. You may also be tested on proper instructions for patients with mobility issues to help prevent injuries in their own home. Knowing how to handle hazardous and infectious materials is absolutely a key element of keeping yourself safe as well as other clients in the healthcare environment. While medical facilities may further outline how to properly do this based on processes within that specific facility, it is important that you're able to identify universal standards in order to prepare for your NCLEX. Some key scenarios in this category can deal with helping to um, safeguard yourself around bloodborne pathogens, one of those in particularly being HIV and AIDS. Many of our patients are not sick. Many of them are brought to the hospital environment because of injuries. And rightfully so, we have key patient populations that are at higher risk of injury just based on their developmental stage and age. Specifically, our youngest populations are toddlers and infants, and then our elderly population. So having a key understanding of how we can improve safety in the home and help to reinforce it to our clients is a paramount part of what nursing is involved in. And this can really focus on reinforcing teaching and evaluating the client's understanding of what is safe in the home based on that patient's age or their health conditions. For our patients that are having mobility issues, we may be even more concerned about the risk of falling. And so making sure that the home is set up appropriately to help reduce that risk is key. Home safety can include questions that assess the nurse's ability to reinforce key teaching points to help prevent injury to patients in the home. The teaching points will differ depending on the patient's developmental state, age, or physical ability. Test scenarios can include items around fire prevention, prevention of falls in the home, proper storage of chemicals, medication, and medical devices, just to name a few. The next objective covers least restrictive restraints and safety devices. In this category, test questions will test your knowledge of appropriate application of restraints and safety devices, appropriate implementation of monitoring for the safety devices, for example, your safety checks, implementing least restrictive restraints or seclusion appropriately, the appropriate documentation of the restraints and safety devices and client response, as well as checking for the proper functioning of those restraints and safety devices. The next objective in the category of safety and infection control is reporting of incident, event, irregular occurrence, or variance. This category tests your understanding and knowledge of how to properly document and respond to any incident, event, or irregular occurrence, specifically those of medication errors, a client fall, or improper implementation of hospital or care facility policy by another health professional. Working in healthcare facilities, nurses rely on medical equipment routinely to provide care. So this next objective of safe use of equipment will ensure that you are aware of how to properly use the client equipment and ensure that it is safely functioning, in addition to following the protocols and procedures for the safe use of that equipment. The next objective within the safety and infection control category is security plan. This objective will include questions that assess the nurse's ability to initiate and participate in security alerts, for example, in the case of an infant abduction, use principles of triage and evacuation protocols, and monitor the effectiveness of the security plan. This brings us to our final objective area of standard precautions, transmission-based precautions, and surgical asepsis. This category will test your understanding of modes of transmission for communicable diseases. It can be helpful in your study to work to categorize diseases as either airborne, droplet, or contact modes of transmission. This can in turn help you to identify the proper PPE required for patient care. In addition, questions can include scenarios that include topics such as hand washing, aseptic technique, protection of immunocompromised patients, setting up a sterile field, preventing cross-contamination in patient care, and reinforcing proper infection control procedures with clients and staff members. Now let's put these concepts to practice and work on strategies to approach clinical judgment questions. In the real NCLEX questions, you will have the patient chart and information on the left of the screen, while the question will be on the right. For the purposes of this presentation, it may be helpful to take a picture or screenshot of the information slides for reference as you answer the questions. In this scenario, you are presented with an 87-year-old client who has been admitted to the emergency department from an independent living home with a new report of episodic acute confusion, urinary frequency and incontinence, and severe fatigue. The patient is alert and oriented, ×1, lungs are clear, S1 and S2 are present with no murmurs or gallops, extremities cool with capillary refill greater than 5 seconds. Both legs are slightly mottled with edema at a +1. We can review the patient's medical history. We see that the patient previously had a stroke a month prior to this visit, has a history of type 2 diabetes, no known drug allergies, with vital signs of 100.8 temperature, heart rate of 96, respiratory rate of 20, blood pressure of 98/46, and satting at 90% on room air. Your emergency room orders come in, and you have been asked to perform a urinalysis via straight cath, start a peripheral IV, hang IV fluids, and place the client on oxygen via nasal cannula at 2 liters per minute. Our urinalysis has reports listed showing numerous white blood cells, casts, a few red blood cells, and a culture has been sent to the laboratory for further study. IV fluids have been started, and the patient has been placed on the nasal cannula and the oxygen. For each case study, the first question is always centered around the recognized cues clinical judgment measure. In this case, the question type is considered highlight response. This question type is often one that can be used to measure your ability to recognize cues. However, it can be placed in other areas of a case study. You may find that certain phrases are available as options to select as you move your mouse over the overall selection. Reviewing the options, you can work to process the question similarly to a select all that apply question. You can take in each highlightable section into consideration one at a time. The question asks you to identify findings of immediate concern, which is asking for items of priority concern. So you can consider each option and how it satisfies the priority concern, and that can help you to make correct selections. So thinking of what is expected for the patient versus what is unexpected with each option choice as well. The unexpected findings will be of immediate priority to the nurse. The options highlighted in yellow are of priority and immediate concern as they are unexpected for this patient. These highlighted findings are consistent with the unexpected finding of possible infection and dehydration. While fatigue and the mottled skin color and medical history are of concern, they do not necessarily identify key acute issues that may result in worsening outcomes if left untreated. In addition, findings of medical history and those that can be related to chronic concerns are typically never of immediate concern or priority. For this analyze cues question, the multiple response answer choice is provided. In this case, it's similar to a select all that apply question, but you're limited to 3 responses. Reflecting on the key client findings can help you to eliminate answer options. So for each option, it can help you to compare What supporting evidence is in the client chart to support the listed condition or that answer option? The items that have the most supportive findings or the most evidence from the client chart will lead to the correct responses. Based on the client findings, the client is most at risk of developing sepsis due to the concern of infection, dehydration, and orthostatic hypotension. The patient's vital signs raise concern for fluid status issues, which can lead to the orthostatic hypotension. Prior to moving to the next question, it may be helpful to take a picture or screenshot of the client labs prior to answering the prioritized hypotheses clinical judgment question. Prioritized hypotheses clinical judgment questions require the tester to identify the priority concern of the patient. And that is always based on the key clinical findings that are inside this patient's chart. So selecting the item of the answer options that has the most evidence from the client chart and also poses the most risk to the patient will lead to selecting the correct option. It may be helpful to review evidence for each answer option and utilize a process of elimination method. For example, stating to yourself, do I have evidence of diabetic ketoacidosis in the patient chart? And continuing that process with each option prior to finding the best choice. While each of these physiological conditions could potentially occur for the patient, the evidence of the client's health condition supports a priority concern of sepsis. Generate solution questions ask you to identify solutions to the client's health concerns. Utilizing a process of elimination similar to multiple choice questions for each fill-in-the-blank option can be helpful with this question type. In this case, the nurse can expect that the patient be admitted due to the circulation status and the mental status. It is always a good idea to review the client chart for updates as you proceed to the next question. In this case, the time entry of 1,200 hours notes that the patient is transferred to an inpatient unit. The clinical judgment question type of take actions can often require the tester to reflect on the specific nursing actions that will be put in place or implemented for the patient care. When considering the chart style type of question that is shared here, it can be helpful to take into account each option one at a time. Also, rewording the options of indicated to mean helpful options versus those of not indicated to mean those that are harmful. This can help you apply the clinical judgment needed to address this question. In consideration of this patient, the only action that is not indicated is the placement of the indwelling catheter. Use of an indwelling catheter on its own increases risk of infection. So in the case of our client that is experiencing signs and symptoms of infection, this is not helpful. It is actually harmful. IV fluids will be needed to address the patient's fluid status. IV antibiotics will help address the concern of infection. Monitoring lactate levels will help to track concerns of sepsis. And finally, the nurse's documentation of the vital signs will also be helpful to address any client physical signs and symptoms changes as soon as possible. In the final step of a case study, you will be asked to evaluate the patient outcomes. Working to compare and contrast any new client findings with previous clinical findings will prove to lead you to the correct responses. In this case, all of the findings signify that our patient is improving. Well done. I hope that you have found this presentation and review of a case study in clinical judgment helpful as you prepare for your NCLEX examination. Please know that we are here to partner with you on your journey to becoming a licensed nurse. Be sure to connect with your campus NSS for additional resources and support on your journey. If you are a graduate of Concord, Sacramento, or South San Francisco, I look forward to hearing from you soon. Wishing you all the best.